Are you a postmenopausal woman who has recently experienced a bone fracture or loss of height? You may be suffering from postmenopausal osteoporosis. But worry not, because Raloxifene is here. Raloxifene is indicated for the treatment and prevention of osteoporosis in postmenopausal women and the reduction in risk of invasive breast cancer in postmenopausal women at high risk of invasive breast cancer. So what is raloxifene and how does it work? Raloxifene is a selective estrogen receptor modulator. It slows bone loss and keeps the bones strong. It also may lower your chance of getting breast cancer. Raloxifene is not estrogen, but acts as an estrogen agonist in bones and acts like an estrogen antagonist in the breast and endometrium.
Unfortunately, just like any other medication, there are some adverse effects to taking raloxifene. The most common side effect patients experience is hot flashes. During the first 4 months, there is an increased risk for a patient to develop a DVT, or deep vein thrombosis. After the first 4 months, the risk is still present, it's just not as high. Patients with a coronary artery disease or patients at risk of a coronary event have an increased risk of stroke or death by stroke while taking raloxifene. Cardiovascular effects include chest pain and peripheral edema. Some CNS effects could include headache, migraine, depression, insomnia, and vertigo. GI effects can include nausea, vomiting, dyspepsia or indigestion, vomiting, and abdominal pain.
Do not take raloxifene if you are pregnant, breastfeeding, or planning on becoming pregnant, as there is possibility for harm to the fetus. If you have or ever have had venous thromboembolism, you should not take raloxifene, as there is increased risk of VTE and death from stroke while on this medication. The safety of use of raloxifene is not known in premenopausal women and in men and should not be used. Talk to your doctor if you have coronary artery disease, have increased risk for strokes or any liver or kidney impairment. You may require increased monitoring or may be advised not to take this medication. You should discuss the risks and benefits with your healthcare provider before starting raloxifene.
Raloxifene may interact with multiple different drugs. It's always important to talk to your doctor before and thinking about starting raloxifene therapy. Cholestyramine, which is a bile acid sequestrant to help lower cholesterol, may cause significant reduction of raloxifene absorption. Levothyroxine, which is a thyroid hormone therapy, when taken with raloxifene, may decrease the levothyroxine absorption. Warfarin, an anticoagulant, when taken with raloxifene, may cause an increased effect of the warfarin. It's important to continuously have blood draws and follow-ups, especially to monitor the prothrombin time and INR. Famciclovir, another antiviral, when taken with raloxifene, may decrease the effects of famciclovir. It's important to talk to your doctor if you have any or current symptoms of a virus or have tested positive for any sorts of virus, that this could interact and decrease the effects of the antiviral. You should always talk to your doctor before starting raloxifene if you take any of these medications. You may need to find alternate therapies, especially for levothyroxine, warfarin, famciclovir.
The first teaching point to talk with your patient about is to take the raloxifene as prescribed. It should be taken with a full glass of water at the same time each day. And this is a once daily medication. So we want to encourage our patients to only take this one time a day. Do not split your doses. You should also inform your provider of all the medications you're currently taking and before taking any new medications. This includes multivitamins or herbal supplements, just to make sure there's no interaction. The calcium supplement with vitamin D is sometimes recommended because it helps your body absorb the medication, and it also helps with your bone density. Now, one of the contraindications for Raloxifene is pregnancy. So we want to educate our patients about not taking this drug during pregnancy, or if you plan to become pregnant. You should also maybe use a backup birth control method just to help prevent pregnancy. And they also do not recommend breastfeeding while taking this medication. Another important thing to educate your patient about is watching for signs of blood clots. If your patient develops sudden shortness of breath or chest pain, they should go to the emergency room immediately. And if they notice any severe pain, redness, or swelling in one arm or leg, you should notify your physician within 24 hours of when you notice the symptoms. And then if you experience any unmanageable or unusual side effects, you should definitely contact your provider as well. While educating our patients, we should also talk to them about getting plenty of exercise. Keeping moving can decrease the chance of developing a blood clot. It can also strengthen your bones and increase your energy level. If they are out in the sun, they should wear SPF 15 or higher. Otherwise, try to avoid sun exposure. You should be sure to keep all of your follow-up appointments, including gynecologic exams, bone mineral density scans, mammograms, blood work, etc. And we should also encourage our patients to stop smoking and drinking alcohol. These are both known to contribute to bone loss.
If you are a postmenopausal woman worried about osteoporosis or interested in reducing your risk of developing breast cancer, Raloxifene may be right for you. Talk to your doctor about Raloxifene today.